Hello, welcome back to my channel. It's Matilda from Health is Well TV. Please don't forget to subscribe if this is your first time or you haven't already done so. Well, today I'm going to talk about something slightly different from our usual topic. It's a health issue concerning women and anything, to do with health. I'm really passionate about it, and I don't need to be an expert to raise an awareness, especially among women in the African diaspora. It is cervical cancer. What is it? It is a disease caused by abnormal cells that grow in the cervix. The cervix is the entrance to the womb from the vagina. If these abnormal cells are left untreated, they can become cancerous in later years. So what causes this disease? It is caused by a virus called Human Papilloma Virus, HPV for short. This Human Papilloma Virus is sexually transmitted, so any woman who is sexually active is at risk of, getting this disease. So what can be done to prevent it? There is a simple test called smear test that is given to all women free of charge. All they need to do is to make an appointment with their GP surgery to get this, test done. Few years back, a vaccine was produced which is now given to all young girls in secondary schools. But this is not enough. I believe in being proactive rather than reactive, and prevention is better than cure. It is free. It doesn't cost anything. All you need to do is to get yourself to the surgery to get this, checked out, so that tests can be carried out to find out if these cells are normal or not. So mothers, parents, remind your daughters, your sisters, aunties, nieces, friends, to get this test done. I'm aware that some women work long hours, and by the time they close from work, these GP surgeries are closed. Taking a day or two off work to get these appointments and checks, done is a small price to pay for our health and, peace of mind. In my experience, it is a painless exercise, which is carried out, every, 3 or 5 years, depending on the circumstances. It is a bit uncomfortable. I can speak for myself. I find it a bit uncomfortable because they have to get these cells by scraping the cervix, to get it sampled for testing. And if it comes out, if the test or results come out, abnormal, then further tests can be carried out, and, early diagnosis is important because it can then be successfully, treated. Because I never knew anything about this test or cancers until I got pregnant with my first child. I got tested, from the crown of my head to the tip of my toes, and the results came out to be abnormal. And I was allowed to progress with the, pregnancy, and then referred to a gynecologist after the baby was born. Further investigation took place, and then it turned out that everything was okay. But during that period, I was anxious. I didn't know what was going on. And then after every 6 months, I was called back to for tests, and more tests. I was confused and getting anxious. I didn't know what was going on. Until one day, a nurse called me and said, how do you clean up that place? How do you clean it up? I said, what do you mean? She said, how do you clean it up? I said, the way my mother taught me. And I'm sure that's how everybody else does it. She said, tell me, how did your mother teach you to clean it up? She said, clean it inside out. Clean it up. Bring everything out. Don't leave any mess in there. Just clean it up. That's the way I was taught, and that's the way I've been doing it. She said, oh, no, you don't do it that way. It is designed to clean itself out. You just leave it. From what you've told me, there is nothing wrong with you. They have to, get cells from there. If there are no cells, the results will, record abnormal because there are no cells to work with. There are no cells, then they will say it's abnormal because they are looking for cells. And you keep cleaning it out. All the cells that is needed for the test, you clean it out. So don't clean it out again. It is designed to clean itself out. So I was, sent back after 6 months. And after that, they got the cells they wanted. The test came back normal. The results came back normal. So if you're like me, cleaning it out, don't, because it is designed to clean itself out. So leave it and let them get the cells they want, and you get the results that should be the right one. So that is my experience that I want to share with you. Because if the symptoms are so subtle that by the time it is diagnosed, sometimes it is too late. They can range from, say, intermittent bleeding, which is bleeding between periods, or bleeding during and after sexual intercourse, or bleeding after the menopause. And these symptoms can relate to other medical issues. So it's very difficult to know exactly if that's the problem. But once we are, getting these regular smear tests done, is a good thing. Because if there's anything wrong, they can find out right from the start so that everything will be done properly. I still can't forget, about 10 years ago, about a young girl who lost her life to this disease. She was vivacious, full of life, bubbly, so, at the peak of her career, so famous and popular, From what I understand, she never went for a smear test. The one time she did, they diagnosed it was cancer. She was abroad when she was, when the results came and was called back for treatment. But all her fame and fortune couldn't help her. It was too late by the time, they diagnosed it. Within 6 months from being diagnosed, she passed away, leaving young children and a husband. All the money in the world cannot save anyone when it gets to that stage. I know we are all going to go one day, but why go before our time? Why? When there's a way we can prevent it. As for me and my household, we will not die before our time. We will live with good health and sound mind to declare the glory of God in the land of the living. And that's what I wish for you all. So we have to be proactive rather than reactive, as prevention is better than cure. Health is wealth, and when it gets to that stage when it's too late, there is nothing all the money in the world can do. And then we don't need to suffer. We don't need to go that way when there's a way we can, be responsible with our health to prevent all that. So I think I've tried to share this with you to raise this awareness so that you can tell your friends and family to go and, get this test done. These men or women, I don't care whether they are men or women, they are professionals. I don't care. I'm not the only woman they are going to see. And it's a job. It's their job. They are just doing their job. And, they are, they've seen it all. I believe we are all the same. So there's nothing to be ashamed of, or nothing to be worried, nothing to worry about. All you need to do is to make the appointment and go and get checked, so that if it's caught on time, can be successfully, treated. So I know health is wealth. You know health is wealth. So we have to take care of our health, because it's one life we have. We don't have a spare. We don't have it, another one elsewhere. We need to make the most of what we've got until, it's time for us to go. So I wish you good health, and I hope you'll take this on board. And I thank you for watching and stopping by to listen to what I have to say. So until the next time, take care of your health, because health is wealth. Thank you, and God bless you.